Hello, and welcome to this video on Kallmann Syndrome. So what is Kallmann Syndrome? Kallmann Syndrome is an inherited condition that causes hypogonadotrophic hypogonadism. It has a prevalence of 1 in 48,000 in the general population, and a 4:1 ratio in males to females. Pictured on the right is Jimmy Scott, a famous jazz singer whose unique high voice was attributed to Kallmann Syndrome. So how does Kallmann Syndrome work? The production of sex hormones is normally controlled by the hypothalamus-pituitary-gonad axis. Neurons in the hypothalamus produce gonadotropin-releasing hormone, or GnRH. This stimulates production of follicle-stimulating hormone and luteinizing hormone, or FSH and LH respectively, in the anterior pituitary, which stimulates the testes and the ovaries to produce testosterone and estrogen. In Kallmann syndrome, there's a congenital defect in the migration of GnRH-producing neurons to the hypothalamus. This leads to a lack of production of GnRH, which leads to less production of FSH and LH, which leads to less production of the sex hormones. This is known as hypogonadotrophic hypogonadism and leads to the presentation seen in Kallmann syndrome. Most patients present at the age of puberty with delayed puberty. This can present as decreased secondary sexual characteristics, such as decreased pubic and facial hair, short stature, lack of deepening of the voice, and decreased breast growth. Females can present with primary amenorrhea, which is the failure of menarche. Males can present with cryptorchidism, or undescended testicles, and micropenis. Patients can also present with hypogonadism, which will be a decreased size of the gonads. Kallmann syndrome classically presents with anosmia, or a loss of smell, due to defective migration of the olfactory neurons. Patients can also commonly present with a cleft palate or lip at birth. They can present with hearing or visual defects. And if left untreated, the chronic lack of sex hormones can lead to the development of osteoporosis. Now, how do we diagnose Kallmann syndrome? Most diagnoses can be done clinically with some special tests. Since most patients present in puberty, we can test for Tanner staging of puberty and measure gonad size with an orchidometer. We can provide hormonal testing to exclude other conditions, which in Kallmann syndrome will show a low FSH, LH, and sex hormones. We can also provide genetic testing to determine the underlying cause and understand how future generations may be affected. While there is no cure for Kallmann syndrome, patients can live a healthy life with treatment. Patients can be provided with hormone replacement therapy to induce puberty. In men, this is achieved either by administering human chorionic gonadotropins with FSH or testosterone replacement therapy. In females, estrogen can be administered, with progesterone being added once menstruation begins. Patients who wish to have children can be provided with pulsatile GnRH therapy to induce fertility. Thank you for watching this video on Kallmann syndrome, and feel free to check out our other videos on endocrinology